will be sharing their personal insights and their own stories of COVID-19
to help create more awareness around mental health challenges during this pandemic.
Let's take a global stand against COVID.
Teen Talks every Sunday, 7 p.m. Eastern, 6 p.m. Central, 4 p.m. Pacific times, only on TV Asia Telugu.
Hi, this is Anjana Shokchari welcoming you all to Teen Talk. We are ready to begin our first event of our Global Stand Against COVID event series, which is a humble attempt by students to help students across our global community cope with one of the pressing challenges introduced by COVID-19, keeping a strong mental health. With mental health issues being a global challenge even before, the pandemic has both increased and introduced new challenges specifically to the student population. Students across the world have been feeling increasingly anxious and stressed due to the fear of the unknown in various areas such as health and wellness, their academic futures, job opportunities, and many more. In association with the Lions Club International, a few of us Leos from the New Jersey Renaissance Lions Club have started this initiative with a goal of addressing some top student concerns that affect their mental health. We've polled 100 plus students to capture their concerns across various age groups such as middle schoolers, high schoolers, and undergraduates. And today we will be focusing on those questions that relate to overall health and wellness. We have some prominent speakers and panelists present today who have made time for us amidst their own very hectic schedules and are going to be providing their insights towards helping students cope with this pandemic. We do want to highlight that the recommendations offered through this show are informational in nature and should not be used in place of a proper medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified healthcare provider if you have any questions regarding a medical condition. Without further ado, I take great pride in introducing our panelists for today and looking forward to an information-filled interactive session. Dr. Raghuram is a leading cardiothoracic surgeon practicing in Tamil Nadu, India. He has performed over 10,000 open heart surgeries in the past 25 years. He is also a fellow of Royal College of Surgeons, Edinburgh. He is a Lifetime Achiever Awardee from Tamil Nadu MGR Medical University, as well as an international member of the Society of Thoracic Surgeons of America. Anne Basil is the Director of Behavioral Health Services at AmeriGroup. Her team works directly with individuals and families covered by AmeriGroup in New Jersey, and also the hospitals and treatment providers seeing their members. She's also the mother of 2 children, both in 5th and 7th grade, and lives in New Jersey. Arvind Gurprasad is a managing director in a leading investment bank. He's been in the financial services industry for over 15 years. He graduated from an Indian School of Business with an MBA degree and also from Oregon University with an MS degree. Sriram Natarajan is an associate professor at the Director Center for Machine Learning in the Department of Computer Science at the University of Texas. He is also the director of Starling Lab at UT Dallas. He has published several research papers in the fields of artificial intelligence and machine learning, and also teaches doctorate students. Niranjan Ramakrishnan is a certified CIO, an entrepreneurial and driven chief technologist with 20 years of leading healthcare industry expertise in leading numerous companies in domestic and international marketplaces. He is recognized as one of the top 10 CIOs in the Indian healthcare industry by the eHealth magazine. Dr. Deepthi Raghuram is a gynecologist and obstetrician with a special interest in fetal medicine. Dr. Arun Jeevagan is a consultant physician and a gastroenterologist from the East Sussex NHS Healthcare Trust in London, UK. Priya Karthik is an engineer with an MBA. She is a certified professional coach, certified life coach, mentor, and public speaker. Empowering students to succeed and transforming them into leaders is her mission. Karthik Balakrishnan is an associate professor of accounting and teaches financial accounting and financial statement analysis to MBAs. He is a recipient of the London Business School Excellence in Teaching Award. Jyotsna Kather is a Tony Robbins certified coach and an executive functioning coach with a proven track record of 20 years in the corporate world. Surabhi Soni has a master's in clinical psychology, who has been doing counseling work for the past 15 years, after which she went back to school and completed her training in applied behavior analysis. She currently works with individuals with autism as a registered behavior therapist. Priya Shah is a doctor of physical therapy and a mother of 2 wonderful kids. She currently works as a senior clinical supervisor in SSJA Nursing and Rehabilitation Center in Brooklyn, New York. And she has 15 years of experience working in clinical physical therapy. More recently, she was fortunate to treat COVID-19 patients in the rehabilitation unit.
I commend the GSACovid team for coming up with this beautiful initiative. Talking about mental health is the need of the hour, not just for students, but for everybody in a diverse set of workforce, be it professionals, be it doctors, be it educationalists. Talking about mental health is the absolute necessity. Everyone's going through, across all age groups, across all regions. It's just been an incredibly challenging time for us, and creating this initiative is an incredibly nice forum, and I'm happy to be part of this. Thank you.
I congratulate Anjana and her team for this initiative, and thank you for inviting.
So I'm very excited and thankful to be present as part of this panel to discuss specifically mental health and issues around the pandemic on students.
Hi everyone. Hope you're doing great. Thanks for the opportunity to share some of my thoughts in the situation. It's a daily norm that we talk about.
Thanks for inviting me to be one of the panelists in this forum.
Hello, and thank you for the opportunity to talk about how the COVID is having an impact on students of different age groups. And it's a very important topic. And so I'm glad that I've got this opportunity to share my thoughts. So I would like to first begin with a thank you to the organizers of GSACovid for this opportunity and for creating this platform that can be of great help to a lot of students who at this point are going through a lot of questions on how to deal with the uncertainty that they are facing.
This is amazing. I am both honored and humbled by the amount of experience and wealth of knowledge we have here in this forum today. Let's start with our first question, one of the prominent high school and undergraduate questions.
How do we maintain a healthy mindset about this pandemic?
Let's start with our medical professionals.
Well, it's a very important question, especially at this juncture. So let me enumerate a few points. First and foremost, minimize watching, listening, and reading articles on COVID-19 because those are just flooding the internet because it will just make you anxious and distressed. Follow only trusted sources like WHO or Center for Disease Control and Prevention, and moreover, follow them like the maximum of once or twice in a day and do not follow every minute. Secondly, be of help to your neighbor, especially the aged and the disabled ones, by providing physical and emotional support. So it's not just going to be helpful to them, but it will also make you feel energized and satisfied and motivated because you're being of use to the society. Thirdly, listen to and share the stories of COVID warriors, the people who have gone through this and overcome with zeal. That will help you to keep yourself motivated. Fourthly, discuss your concerns with your parents, well-wishers or friends involve yourself in the family. Utilize this as an opportunity to develop bonding as a family. And fifth, and but not the least, is your passion, like playing instruments or music or drawing, whatever is your passion, engage yourself in it. So those are the things that you were not able to contribute much because of the hectic schedule that you were in previously. So engage yourself in all this. So I think these are the things that we can follow to have a healthy mindset even in this terrible situation.
Very well asked question. Coronavirus or COVID-19 accelerating in a whole wide world so rapidly with no known cure or prevention yet. It gives people anxiety and fear. In this situation, it is very important to have a positive outlook and healthy mindset. But how? It is very important to have a structural routine. Morning to proper time to get up, to proper time to sleep. If you are taking online classes, it is important for you to get up, dress up, and sit in front of your laptop the way you are going to school. Proper healthy habits, proper food habits, proper physical activities in your daily routine will help you to maintain a positive mindset. Same time, stay connected with your friends and family will also give you a boost to your positive mindset.
Moving on to our academic and technology leaders.
As I started, life is so short, so make it pleasant for you and others. I do not have time to really let my health and mind to go down. What should I do to keep it healthy? I know I have to accomplish something. I know like every day counts for me. So if you're really looking at that kind of a larger goal, larger picture in a life, you'll not even have time to really worry for the small issues that it came into your life or in your family member's life, etc. Right? You have to support, you have to fight back, but end of the day, you have to really look at a larger goal that you wanted to achieve. You have a lot of work to do to complete your task that you're taken up. So what really makes the critical part here is, did you identify the larger purpose of your life? Did you fix up a target for yourself? Did you plan that, okay, end of my 30 years, 60 years, 70 years, whatever the life that you wanted to live, have you really fixed up a goal? Have you fixed up a target? And did you make your project plan for your life? The moment you do that and you start working towards that, I can challenge you, your mindset to be extremely healthy. And I just follow in my life. I have to, for me, every day counts, and I'm working very hard. And I know I'm running short of, sometimes I feel like I'm running short of time because my goals are larger than what I could really handle. And then I keep myself extremely busy. So that's the most important thing I would say, to keep your healthy mindset and the environment also very, very interesting for you to kind of deal with.
On one side, I myself had a lot of plans. 5 PhD students have graduated this year. It's kind of like a big deal. We should be celebrating, we should party. We didn't get to do any of this. But the way I think about it is, if this is the extent of my problem, then I really don't have a problem. Because 90% of the people have much bigger problems, and they would give an arm and leg to be where we are. So I'm very, very, very privileged, and I recognize that. Okay. The positives for me, I try and look at the positives. Since my son was born in 2016, he's 4.5 years old. This is the first time I have spent a chunk of 5 months with him at home. Okay, I've been constantly traveling, sometimes weeks together, it's been so rewarding to be with him for 5.5 months. Same thing with my wife. It's been 7 years since we are married. It's the first time we spent 5.5 months inside the same house. So the point I'm trying to make is that I'm trying to count the positives, and we are trying to be compassionate and try and help the people who don't have as much positives as we do. So I think that we should all try and be positive as much as possible.
So that's sort of the questions that I thought were very important and I wanted to answer, and that I thought I could share something from my perspective. But overall, again, I would like to highlight the point that while it's definitely uncertain times and we are all stressed about it, first of all, we all should agree that we are all stressed about it. And so that's absolutely fine. Right? Having that stress is okay. We were stressed back in 2008, 2009. We came back strong. We are stressed now, we'll come back stronger. All right? And that's what you should remember. Stress is going to be there, but we'll all find our ways in which we can sort of navigate these uncertainties and flourish in the new environment that's going to come up post the coronavirus world. All right? And the key to that is to continuously think about learning in any environment. It does not matter whether you're physically present in the college or not. It does not matter. What matters is that you're learning and you're updating your skill set. Along the way, I'm pretty sure there'll be an opportunity that knocks your door. You just have to be patient for that, and you have to jump on board and do really well. I'm pretty sure you all will do that. So very best of luck to all of you out there, and have a great career in the future. Good luck.
And over to our coaches.
When the whole world is screaming negative things about the pandemic, it is hard to have a positive outlook towards it. But I'm going to give you 2 tips. The first thing, is this pandemic a permanent situation? No, not at all. It is something transient. It is just a phase. And remember, it is just a phase. It is going to pass on soon. Secondly, focus on something that is within your control. Start working on it. Prepare yourself. And over a period of time, you will see yourself starting to do things rather than fearing things. You will very soon be accomplishing a lot of things instead of just sitting and complaining. And this is going to help you look at yourself and the pandemic in a completely different manner.
It is very easy to slip into the gaps. Okay, it's the easiest thing to focus on video games or waste your time, stay up all night and be worried about what's happening. But this is the time to follow your passion, to find out what you're best talented in, right? This extra time, you can do a lot more things. You can read, you can do research, self-reflect, like help your siblings and your parents in it. So this is a very important time to invest in yourself and your family.
Absolutely. Staying optimistic and disciplined definitely seem to be some of the toppers towards maintaining a positive attitude during these difficult times. Moving on to our next question, which was one of our most asked as well as sensitive questions.
How do you start a conversation about mental health with parents who refuse to believe in such problems?
Broaching the subject of mental health is always a difficult conversation. It was even more challenging earlier, many years back. The exposure to mental health education was much lesser when your parents would have grown up compared to what it is now. My view is having an honest conversation with your parents. It's not going to be an easy conversation, and you shouldn't be expecting results from the first conversation. But a continued dialogue with your parents is going to be helpful. Remember, your parents are also going through a significant mental crisis. They have work, they have families, they have financial things to take care of. So it's not going to be easy on them, but having a meaningful dialogue with your parents is definitely a first step.
In my opinion, there are 2 facets to this problem. The first facet is the most common one, which is that mental health is generally perceived as a taboo in many communities. And I don't think I have the pedigree to discuss that, but I can point out to this numerous articles written all the way from celebrities to global leaders to mental health experts on why it really shouldn't be a taboo. Okay, but that's part A. Part B, and probably the most important one, is that parents tend to think that mental health is not really a big deal because they, in their times it was not discussed as a big deal. To those parents, we first have to understand that you have to come from their side. In their age, when they grew up, they did not have so many avenues that we have currently. So many avenues that you have currently can cause tremendous mental strength. So from a personal perspective, they did not go through any of the many things that we have gone through. Their stress and their mental issues are different to what the children are going through these days. Okay, for instance, personally speaking, when about 30 years back, when I was in the middle school, starting the middle school, I used to travel by bus where I was bullied a lot. Okay, and it was just 45 minutes in the morning and 45 minutes in the evening, but that 1.5 hours felt hell for me, to the point that I was scared to even get into a school bus. It was kind of traumatic towards even my high school and later school years. Why? Because we had to take the school bus to go to on tours for some inter-school competitions and so on, and I couldn't get myself to travel in a school bus. It was a little bit traumatic to do that, and this again was before any of the social media existed. Okay, heck, we didn't even have a telephone at my house. So in those times, it was pretty bad for me. Now you add the pandemic, you add all the different social media that are currently present, and on top of it, the multiple avenues of pressure that the students are taking currently, right? So all the way from how they have to look physically, how they should be emotionally, whom they should be attached emotionally, their expectations in sports, their expectations in academics. So you get these pressures from multiple different directions, and because of which the students are inherently getting affected. Okay, and again, you do a small mistake. Back in the day, 5 people talk about it, it's done, we forget it and we move on. Now it's all recorded, it's there on the camera. So people and students are under constant pressure all the time. So this is a real problem for many kids. So that's how I'll open a conversation that, look, put yourself in the current scenario. Think about you in this scenario. Okay, you in your professional life, you make a mistake. You say something that you don't mean to, but it gets recorded. Can you imagine the amount of pressure that you're going through? Okay, so I'm going to open up conversations that way. That's how I would talk. That's how I would open up stuff. And specifically during the pandemic time, when they're all going through so much already, all the way from online classes, the lack of face-to-face communication, the lack of the ability to hang out with friends, I think it amplifies the problem. And I would definitely be compassionate about this, and I would open up a conversation to the parents from this perspective.
Well, I think it would definitely help if we were able to understand this from a parent perspective as well.
Well, it's absolutely understandable that letting parents know how you feel, or you're feeling sad, or you may need the field to speak to a professional, could be really tough. It could be various reasons. You feel scared, you feel embarrassed, or you simply feel that they're not going to understand you. So yes, it can be challenging. However, let me tell you something, that parents almost most of the time are very empathetic and understanding, and non-judgmental to their children. If kids make an effort and reach out to them and let them know that they want to talk, all you have to do is let your mom, dad know, hey mom, hey dad, I need to tell you something. And you will be surprised that they will be willing to give you their all ears and sit down with you and listen to you. Sometimes it's important to express them more calmly, without the bias in your own head that, oh, they're just not going to understand me, but I'll still try. You know what? How about trying it in a way that, okay, I'm going to try to talk to them, and I am sure that they will understand me. When we change our perspective to they will not understand me from they will understand me, things become a little more simpler. So I would suggest that you try this, and if you really still feel scared and you feel super confident that they're just not going to be able to believe you or listen to you, take help of a friend, take help of a family member who you think you trust and you can confide in, and you think will be willing to speak to your parents on your behalf. It's not rocket science, kids. It's just your parents. And believe you me, they are there for you. You are their hero, and they're always there. You just have to reach out. All right, try it. It's going to work.
Yes, that is very assuring.
Most important thing is to make the parents understand that there is a problem. Acceptance of the presence of the problem is the first step in finding a solution for the problem. It's nothing unusual for children to feel a little down because going to the school is not simply to satisfy their academic appetite. The interaction with their peers, with their friends, with strangers, with their teachers, it's a great learning experience for them and they enjoy it. And absence of that for a very long period really puts them off. So once you know that there is a problem and you accept it, the parents must be encouraged to spend more time with their kids. It's a very bad method to just allow them to surf on the net with this iPad or iPad, because one thing is because there are a lot of sites which are not very healthy. Even if you exercise parental control, there are some sites which escape all that. And secondly, it's bad for their posture and therefore eyes. So spending physically more time with the kids is very important. And engage them meaningfully by playing some games or telling some stories or engaging them in some healthy family gossips. So keep them continuously engaged. And of course, this is the era of now online classes. It is something, it's a new norm which children are, even the parents are not used to it. So the children will need a lot of parental guidance for going about these online classes in making their assignments and then trying to understand. Sometimes the parents also will have to do a little bit of reading and identify themselves with the kids so that they are encouraged to learn in the proper way.
Is mental health issue is different from your any other health issues? No. Mind is, it is a combination of multiple impact of a lot of organs in your body and the way you respond to the kind of situation around you, the way your thinking process and the way environment that you are part of it, etc. How do you deal with all these things, right? So first thing is, if you can really make them understand what is the change that people see in them, how that is really impacting them as well as the people around them. If you can really explain, if you can really make them to realize that change, then it is they would start accepting that that it has to be addressed. It has to be So there is a denial of mental health issue across the humanity, people around us, right? So the most important thing is make them realize that what is the change that's happening within and around them, right?
Of course, and I hope that the parents watching this show take from these wonderful recommendations and practice some mindful listening when their kids do approach them with this topic. Our next question on the show is one of the prominent middle schooler questions.
Due to being indoors, I've been feeling lazy and sick, but I've not been facing any symptoms of sickness. Why is this happening and what can I do?
Well, it's absolutely understandable that letting parents know how you feel, or you're feeling sad, or you may need the field to speak to a professional, could be really tough. It could be various reasons. You feel scared, you feel embarrassed, or you simply feel that they're not going to understand you. So yes, it can be challenging. However, let me tell you something, that parents almost most of the time are very empathetic and understanding and non-judgmental to their children if kids make an effort and reach out to them and let them know that they want to talk. All you have to do is let your mom, dad know, hey mom, hey dad, I need to tell you something. And you will be surprised that they will be willing to give you their all ears and sit down with you and listen to you. Sometimes it's important to express them more calmly, without the bias in your own head that, oh, they're just not going to understand me, but I'll still try. You know what? How about trying it in a way that, okay, I'm going to try to talk to them and I am sure that they will understand me. You know, when we change our perspective to they will not understand me from they will understand me, things become a little more simpler. So I would suggest that you try this. And if you really still feel scared and you feel super confident that they're just not going to be able to believe you or listen to you, take help of a friend, take help of a family member who you think you trust and you can confide in and you think will be willing to speak to your parents on your behalf. It's not rocket science, kids. It's just your parents. And believe you me, they are there for you. You are their hero and they're always there. You know, you just have to reach out. All right, try it. It's going to work.
It's perfectly normal to feel down and out when your movements are terribly restricted. See, it's very important for you to maintain a normal lifestyle by interacting with people, going out, exercising. All those things are terribly curtailed in this era. So there is nothing wrong in feeling a bit down during this period. But what is important is whether you are going to the office, whether you are going through your routine work or not, by going outside, you have to maintain your routine within the house. Like, you must get up at the right time as usual, not spend a lot of time watching movies and other things till about late in the 1 o'clock and then getting up at 10 a.m. So you must maintain the normal time of getting up, finish all your ablutions, get ready to go for office, but of course you cannot go. And then concentrate on your personal health. A lot of them I find that they don't concentrate on their personal hygiene because they are not going out. And keeping a tab on your diet, maintaining a healthy meals at regular intervals, and doing regular exercises, indoor exercises. Of course, if your accommodation allows you to go up to the terrace and do an exercise in the open without wearing a mask, then it's very useful. Otherwise, at least maintain the indoor exercises. Allocate proper timing for your work, for rest, and for social interactions through the social media or video call, maintaining contact with your friends, with your relatives. You have to make time for doing things the way you enjoy. And unfortunately, the way things are going, it may extend for a longer period. So we must find out methods to keep ourselves properly engaged and give ourselves proper rest.
Being stuck at home for a long period of time in this current climate is the new normal. Unfortunately, this would require a completely new approach to deal with the issues arising out of this new norm. The actual feeling of nauseous sensation, actual feeling of sickness could be due to many reasons. Feeling bored, a feeling of incompleteness, a feeling of not being worthy, lack of productivity, mental stress, anxiety, lack of physical activity, not able to do things you would normally love to do. All these will definitely make you feel the way you've been feeling. Your body and mind takes a lot of time to get used to this and then accept this and adapt to the new norm. To defeat this feeling, everyone should have an insight about what's causing these issues. If you have that insight in the first place, most of the issues would resolve by themselves. Setting goals which are necessary for your career and your studies, prioritizing jobs, healthy balanced diet, regular physical exercise, being with the family and friends, they all help. They all definitely help. And mainly, accomplishing them on a daily basis would definitely make you feel complete and less bored. I agree, it's very easy to advise, but very difficult to put in practice. But this is the time we need to persevere and be much more disciplined. This is going to be just a passing cloud, and we will all, definitely, I'm pretty sure we will all get through this safely.
Being indoor for a long time can affect physical and mental health of individuals, which is proven by so many theories. It is important to schedule your physical activity into your daily routine. Physical activity or exercises increases the blood circulation, move your joints, same time releases some hormone which helps you to feel better. Luckily, nowadays, with maintaining proper social distancing, wearing masks, we can do some outdoor activities like a simple walk or bicycling. It is important to not feel confined and keep your physical activity into your daily routine to be healthy during this tough time.
Indeed, keeping busy and following a routine and investing time in both physical activities and other learning activities do seem to be great ways to avoid feeling sick. The next question is one with a broader focus.
So, how would COVID-19 change healthcare?
One of the silver linings to COVID-19 is that discussions around mental health are becoming much more commonplace. Even something like social distancing, which is a critical tactic in stopping the spread of the virus, can also increase mental and emotional health challenges. There's a strong connection between mental health and physical health. One affects the other. Did you know that approximately 1 in 5 Americans lives with mental illness? Did you know that an estimated 3.2 million adolescents aged 12 to 17 in the United States had at least one major depressive episode? That's a lot of people. And an ongoing event such as this pandemic can cause people to feel anxiety even when they normally don't. The more we're able to talk about mental health and substance abuse, the more we can squash the stigma and get help out there for the people who need it. There was a time when people didn't talk about physical health diagnoses, such as cancer, but that's no longer the case. The same can be true for mental illness, substance abuse, and social determinants of health, which are access to things like housing, education, and food, which not everyone has. We're also seeing that the pandemic has created a shift towards online services. For people who need mental health, substance abuse, or physical health care, it's becoming increasingly easy to speak with a medical professional virtually, making it easier and more convenient for people to get the care, services, and support they need to improve their health.
Life in general is going to be much different from what it was before. Taking healthcare in particular, telemedicine will take the forefront compared to the direct face-to-face interactions that we had with our patients. But not just consultation, there's going to be an increase in the online testing, at-home preventive services, and management of symptoms which can be addressed at home, etc. From a gynecologist perspective, I feel that we are able to address the people's problems and especially allay their anxiety as soon as they reach out to us in a much more quicker manner. So we should definitely embrace this technological advancement. But at the same time, I feel that these kind of technological advancements may not be accessible and affordable to a significant section of the society, especially in a country like India. So there is a potential chance that underprivileged and poor may be left out. So coming to the second change that I anticipate is the contact tracing and tracking to locate potential sources of infection as a public health surveillance measure that will continue to operate for a longer time. So looking at this from a different dimension, there could be a problem with invasion of privacy or ethical issues that can be brought up because of this. But considering the major health crisis that's going on, I think that will become a norm. Thirdly, I feel the focus on healthcare and the percentage of GDP spent by the government in the infrastructure of intensive care and preventive services will definitely increase. As we have seen in this COVID era, countries which had the intensive care infrastructure definitely fared better than the countries which did not have. And of course, there will be a change in the mindset of people. Physical distancing and hygiene will become the norm, and it will become the habit of the younger generation, irrespective of the orders from the government.
Of course, there's more awareness to personal hygiene and social distancing. Apart from that, that is something major that I feel will affect the healthcare.
We have seen the tendency to admit patients and treat patients have changed. The patients with COVID symptoms takes the priority. Rest of the patients who have non-urgent, non-emergency symptoms are advised not to come to hospital. Most of them don't realize majority of the emergency conditions, life-threatening conditions, do start with mild symptoms. And because of COVID, what we're currently doing is we're worried these patients who come in with mild symptoms might get COVID and might get serious life-threatening pneumonia and death. And the population in general are worried about contracting this disease. What I have seen even in patients who have symptoms of cancer, they come to a conclusion that if they come to hospital to diagnose a cancer, and they might get COVID infection. The prognosis from a COVID infection, especially in elderly population or patients with multiple comorbidities, very high. A cancer diagnosis would give them 6 months to 1 year to live, but a COVID infection might cause death within few days. So a lot of elderly patients, especially, and patients with high risk category, patients who are living in a care home, residential home, they are treated where they are. Unfortunately, what we noticed, more than a quarter of these patients who died at home or nursing home or care home, who've been told not to come to hospital, have died of reasons other than COVID. Most of them would have survived if they have been admitted, if they have been treated at the right time. And I suppose this will continue as long as the pandemic continues. It's unfortunate. We also noticed that in the near future, we'll be only dealing with emergency cases, elective surgeries, elective procedures. They all been delayed. Patients waiting for hip replacement, hernia surgery, they all been postponed. The truth is, they're all living in pain and discomfort. The productivity goes down. They feel depressed. They get other illness because of lack of activity. They get diabetes, hypertension. So it has completely changed at all levels. The primary care, secondary care, and tertiary care healthcare system has completely changed because of COVID-19. Most of the clinics are done by telephones or video conference. There is no person-to-person, patient-to-doctor interaction in person. There's no examination. So how we treat patients, how we manage patients have changed. How we diagnose patients, how we talk to patients have changed. So the consultations are completely different nowadays because of COVID. This is going to be the same for next few months. All education activities which might help learn new things for doctors, medical students, nurses, healthcare professionals have all come to a standstill. I hope this situation would change by early next year. The other main thing we noticed in the healthcare, various professionals including doctors, nurses, physiotherapists have been allocated to work in a completely different field because of the need for these healthcare professionals at various departments. And they have to retrain, relearn new things to treat and manage these patients. Thanks.
People realize that if we ignore some of the key things, just as could be simple, like what is the immunity level, for example, or the hygienic part of it, or even the simple like how the hospital should really handle with kind of situations like this. People started realizing it. In India, like there are like evidences that almost every other Indian hospital started adopting telehealthcare technology. In Europe and the US and every part of the country, people understand that you got to have a kind of a situation where you should be able to deal with whether it's a patients, with the vendors, or with these technology partners, or with allied health kind of systems. How to deal with them in a technology based or virtual based or etc. So there is one major change that people started adopting the technology post COVID or during the COVID period. Number two, the priorities. People that they thought that it should be only for the treatment or for kind of disease, etc. It's changed now. Like people are really like looking at it. How to keep yourself healthy. So the wellness part is really like getting more traction. And the last but most important thing is the value that the healthcare systems and the people and the healthcare systems we're getting, or where people looking at them as the value-based system now is, I think, would say it's gone up multiple times. So the focus is back on the healthcare. That's what I would say. If you look at that as such an opportunity, healthcare is going to be the industry that you should really look at it for next 5 to 10 years.
Yeah, lots of changes are already happening, and there are more coming up on the healthcare horizon, primarily around virtual visits and more focus towards mental health. Moving on to our next question.
Has working from home affected your mental health?
Working from home has been a unique, interesting experience. Initially, I thought it's going to be great. I have a long commute. I can save on the commute. But 5 months into this, I feel like working from home has blended the lines between my professional life and personal life. I don't know when my work starts, when my work ends, when can I spend time with my kids, take time for myself. And that's been an incredibly unique challenge. I like talking to people, connecting with people, meeting people in person, getting a drink, getting to know people, and that's something I sorely miss. I'm able to do my work somewhat effectively, but then going back to work, meeting my colleagues, that's something I sorely miss, and I'm looking forward to, doing that hopefully sooner than later.
You continue to deal with the laptops and, virtual systems, though there are people around, the other side of it, but the kind of face-to-face interactions, the feel of sitting next to each other, talking beyond office styles, and things were missing now. So we try to really limit ourselves to the kind of official discussions, project discussions, and then we kind of finish the sessions, and then we get back to live. So the way that to deal with this, organizations should consider engaging the employees beyond the job during even working from home or a virtual work environment as well. There should be they should spare some time to kind of interact with all the colleagues, make jokes, play, have fun, and things like that. If it's going to be 13-14 hours of continuous work, naturally it's going to really affect. So far, I wouldn't say that it really have an impact, but if you continue to do this for next few years, things are going to be really bad. So the HR system for the virtual health has to really gear up, and then they should start really focusing on engaging the employees and their families and things like that.
Okay, so here is the thing. My coaching was always one-on-one and face-to-face. But you know what? Because of the situation, I had to be flexible. I had to find new ways to add value to people, right? I couldn't sit down at home and say, hey, because of the COVID situation, I'm not going to coach. And guess what? In May, I decided that I was going to conduct virtual coaching sessions. And that has helped me transform a lot of kids. So that's what I tell everybody, that please be flexible. Flexible enough to learn technology and leverage the remote learning and remote teamwork, remote everything.
Thank you for those interesting opinions on how working from home can make you feel and how we can continue to maintain strong mental health while still working from home. Our next question is also of a critical situation that COVID has posed for a lot of people across the world.
How do the people who lost their jobs due to COVID-19 or have a parent who lost their job continue to support their households?
Well, there is no magic wand. It's a problem the whole global population is facing today. Of course, one of the methods to tide over the problem is to limit your expenses, and fortunately with the curtailment in many of the recreational and then travel activities, a lot of expenses are automatically curtailed. We must find out alternative employments, develop new skills, and find out how we can self-employ ourselves. That is the only way. It's a slow, continuous process. The way things are going now, probably this problem is going to last for at least a year. So we have to find a solution. There is no shortcut for this.
Many crises have happened in the past. Crises are associated with economic downturn, recession, job losses. But if you look at the past crises, every time we've had a difficult situation, the markets have rallied, jobs have come back, economy starts booming, we always bounce back, and I don't have any doubt that this wouldn't be the case for this time. This crisis is unique, like I've discussed in many ways, but not unique in a way that we will not bounce back. As students, as college graduates, as middle school students, high school students, I would worry about things that are in our control and not worry about things that are not in our control. Things that are in our control are staying positive, keeping our physical and mental health, as best as we can, and upskilling ourselves, continuing to focus on reflect in our life, careers, and see what we need to do to get better, than worry about a job. The job will eventually happen, and that's not something you should be worried about at this time.
Okay, we cannot go back and change the past, right? So end of the day, you need to have the basics, support systems. You need to have the savings. Sometimes the political system supports, sometimes the family system supports. In some countries, the entire family comes in and does the helping hand. Somewhere like the government supports, etc. But at the end of the day, how do you really make yourself self-sustainable is the most important thing. But assuming that you're not taking enough care and you lost a job, your family members lost a job, and you're in a situation, how do you really now start supporting yourself? Number one, every challenge is an opportunity. Is COVID is a challenge, is an opportunity? I would say, for all those people who are really how they know how to think different, this is the greatest opportunity. People who want to just give up, it's the biggest problem for them. Lot of examples, thousands of examples are there how you can really convert this challenge into opportunity and start really supporting you and your family financially and morally, right? So simple answer is look out for opportunities, understand the challenges people are going through, come up with some creative solutions, and I'm sure you will have enough resources around you to kind of come out of these economic issues or the kind of household management issues, etc.
Yes, pandemic situation has made a lot of twists and turns in many people's lives. But in spite of that, we need to just keep moving on. It is very easy to advise, but I find that these two simple tips, thinking that this is a transient phase, something that is that will move on soon, will help you first. Secondly, focus on what is within your control. Start working on yourself. The best thing to do right now, even when there is not too many job opportunities, to improve yourself, enhance yourself. Take a moment to start thinking about what are the things that I need to be working on in order to accomplish my dream career. What is something I'm lacking? Find out, make an analysis of what your strengths and weaknesses are, and start working on your weaknesses first. That is what we are always running away from. The moment you start refining yourself, you will automatically set yourself to a better position. When the situation gets better, the job opportunities are going to come behind you. All the best.
Yeah, I would encourage every single teenager to do something valuable during this time. Okay, so the thing is, you could remotely tutor younger kids in whatever you're passionate about. You want to teach them dancing? There are younger kids that you can teach dancing. Or you want to teach academic math or science? You can do that to augment some amount of earning, right? Staying at home, you can do a lot of things. Also help your parents with different activities and chores. And also there are paid internships that are out there that you can do during this time.
These are such valuable ideas and tool sets that students can use in order to help out in any way they can. We are eager to put these to use and help to our best possible extent. Moving on to our next question, which focuses on physical difficulties.
Is it mandatory to have masks on during PE? What about during lunch? What are the safety protocols while eating food?
It's absolutely mandatory to be masked when in a public space. Regarding lunch and meal breaks, the Center for Disease Control and Prevention has issued a set of guidelines in March of 2020. So let me enumerate a few points. Firstly, they say it's better to avoid any kind of group gatherings or eating in crowded places, and grab and go meal options are the ones that's to be preferred. Then self-service stations. They have specifically mentioned about the self-service stations like cereal dispensers or ice cream dispensers. It's preferable to be scaled down. Food service staff, they should be appropriately trained to be masked and gloved while preparing and serving food. Also, if they develop any kind of symptoms, be it mild or severe, they should not be allowed to work. Hand washing with soap and water for at least 20 seconds before eating is recommended. Wipe the area with a disinfectant after you're done. Then another point which I would like to emphasize here is the one that I have seen personally is while snacking, people tend to pull down their masks to the neck and snack. So this is a very wrong practice because there is a chance that the inner surface of the mask, which is supposed to be sterile, which is in contact with the nose and the mouth, as it gets pulled down, there is a chance that it gets unsterile because it's closer to the neck. So avoid such practices. Follow the proper protocol for donning and doffing of mask, and then you should be fine.
I think that's very helpful. Thanks a lot. Moving on to our next question.
For people who gain comfort from physical contact, how do you suggest attaining that comfort during these times?
Okay, social distancing is imperative at this time. There is physical contact is 6 foot, right? But you can have a semblance of physical contact by meeting your friends on their driveway or doing some activity that is like sort of online. Have a physical challenge, like count the number of steps that you're doing. Something silly, but practice social distancing when you're doing that. I usually drop into my neighbors. I stand on the street and I honk and they come out of their front door. We talk everything. We talk silly things. We crack jokes. And I get my fix of having sort of physical contact with them.
These are some great and innovative ideas. Moving on to our middle schoolers again.
My parents enrolled me for a fully online class, but all my friends are doing hybrid. I'm afraid I'm going to be left out. What do I do?
It is fine to think that you will be left out. However, your parents are your best well-wishers. I'm sure they have been following the statistics and news of how things are happening around them. What are the dynamics of the state with the cases? And they're just simply worried. And I think as parents, they have a right to be worried about their kids. And I'm sure they will come around if they will feel that it is okay for them to send you to school. They will let you go to school. I would suggest that you don't argue with them. Do not ignore their concerns. They only wish your best, and they are just trying to protect you from not letting you go to school if that's what their decision is. But trust me, once they're confident and they know that you will be safe, they will let you go to school. And as parents, do not have any intention to homeschool their kids. And that I can say 100%. We don't have any intentions to have you sit in the house all the time.
I think that's incredibly thoughtful and true. And us students should continue to use these guidelines to help keep up and help our parents make the right decisions for us. Our next question is,
how do I cope with the death in the family?
Okay, death is always very hard. There is no magic bullet or magic solution. You've got to go through the motion, be there for your family, take it one day at a time, and seek help if you're not doing well. Please never be afraid to ask for help.
Death of a family member is always difficult. It's become further worse in a COVID situation. Many cultures, many societies, many religions have their own rituals for a closure, and that's the rituals, however ritualistic they are, helps in creating a closure, and that's something sorely missing. I talk to many of my friends who have lost near and dear family members, and it's been incredibly difficult. The first thing that they say is they're not able to connect with other members of the family, share their grief, share how they feel, and that's been the most challenging part of COVID. We evolve, we come up, every single time there's a challenge put on humankind, we find ways to get better at it and evolve. So, I'm sure there will be other, things that will come through from a crisis time to stay connected with people, but that's been a challenge.
Death is inevitable, right? Every one of us came in and for a purpose, and once the purpose is through, like we have to, say goodbye to this world. I lost my dad a few years back. I thought that's the end of my life, because I thought without him, I thought there's nothing for me in my life. But today I'm alive, I'm smiling, I'm still talking, I'm still working on my project, still I'm talking to my friends and families. And so what does that mean? Like, does that mean that I forgot him? Absolutely no. But I realized that, okay, he did his purpose of his life, so he signed off. But he left a lot of things for me to kind of follow, learn, kind of, So every minute I thank him. So understand that everyone has a purpose, and once the purpose is through, that they live, and rest of the world continue to exist and people are living, and you have a larger purpose of kind of a story to kind of complete. You have a larger things to accomplish, so your journey has to continue. But what you have to really learn from a loss in a family is, you should realize that at least with the rest of your family members around you, your friends, please understand the value that you still have them in your life. Start really recognize that and respond to them in a very meaningful manner. So every death actually teaches us that life is so short, but make it pleasant for us and others in our life.
Coping up with death in the family, even during normal circumstances, is a very difficult problem. And it is a particularly tragic experience during this COVID. The main reason is because in COVID era, the death happens suddenly. A person who has been moving around fairly healthy suddenly is taken ill in a matter of a few days, and then he becomes very seriously ill in the matter of a few days and goes into the ICU, and then one day we lose him. And there is no time spent with the dying during their terminal stages, and that is a very harrowing experience. And many times, if you believe in some religious or social rituals to respect the departed soul, we are not able to conduct it, and that's also very difficult. So the whole thing is very painful, and of course holding a philosophical sermon to them is not going to help them. The best way to support them is non-verbal. Just stay with them. Physically staying with them gives them a lot of support. They know that there is a shoulder available for them to cry on, to lean on and cry on, and that gives them a lot of solace. And then it's very important to find out if they suffer from guilt, because many times what happens is the corona infection is contracted by them by visiting some parties or going to some picnic areas or some malls or some pictures, houses like that. And if the bereaved is one of the reasons for their going there, if they had goaded them to go and spend time there, they feel terribly guilty about it.
This is one of the hardest ones because there's not much we can do towards it, but accept it and stay strong. Coming up, we have a question about sports and how to keep up on techniques.
A challenge that I will be facing is that starting from September, I won't be able to go to school, so I can't play soccer for my school team. My question is, how can I stay in touch with my coaches and teammates as well as maintain the physical fitness?
Well, as things are spanning out now, outdoor activities are very likely to be allowed in a short while. But even then, the risk is there in contact sports. If one of the team members is a corona carrier. Of course, new methods of testing are coming up where we can find out before a contact sport is initiated whether all the persons are free from any corona infection. But those tests are not 100% reliable. Till such time it is allowed, it's very important that we stay physically fit. We have to do, especially if, as he said, it's a soccer that he has raised the question. A soccer player has to maintain a good strength of his quadriceps and back, which can be done by doing the regular exercises in the backyard. And then, of course, being a soccer, you concentrate on your dribbling skills and ball control skills and heading skills. So these things can be done in solitude in your house itself and maintain good balance. And as far as coaching is concerned, a lot of sites are now available in the YouTube and all that, where you can, if you are academically minded, you can get a lot of information of how to do the various passes and what are the various strategies. And of course, ultimately you have to wait for the right time to go out and enjoy yourself.
I find it interesting how these online resources can help us out so much during these times. And now a question relating to our productivity.
Now that working from home has affected our productivity and teamwork, what can we do in the future to benefit our work?
No, strictly no, right? Of course, there will be, it's a new environment that we have to deal with. You know, you have office settings, you have continuous meetings in the boardrooms, you have like colleagues to kind of interact with, etc. So now everything has to be virtual, and the family members around you, there are a lot of noise and kind of disturbances, etc. But how do you deal with the productivity issue? Going back, the goal that you kept for yourself in the organization and for yourself and your overall lifetime career, then you have your project plans in place, right? I used to say that in my last 2 years of career path, the most busiest quarter of my effort, work was April to June 2020. Though I was completely at home and I was working for completely, kind of with the virtual teams and customers, but I made it extremely productive and useful because I kept a very, very tight target for myself to achieve.
I don't think that coronavirus has affected teamwork in remotely. Actually, it's helped us be empathetic to everybody else and enhance our teamwork and care about others. So it's actually a lesson that we all need to learn, and a blessing in disguise during these critical times is that we've got to be there for each other. So that's the lesson this situation has taught.
Yes, and this relates to students too, trying to move to virtual solutions in order to keep up with our education. And our final question, but definitely not the least.
How do you suggest people check in with those who have social anxiety online?
Okay, so just like face-to-face where you would go hang out, go to the mall or get ice cream or bubble tea, this has to be replaced with checking in on your friends online, right? Just call them instead of texting them. You know what? Texting masks a lot of things like social anxiety or social skills, or they might just say, I'm okay. But guess what? Just call them or FaceTime them so that you really know from the facial expressions if they're doing okay or not. So please check in on your friends.
Yeah, and this definitely requires some initiative from our end as well in order to keep checking up on the people that need us. And in turn, this can keep us connected and motivated as well. That wraps up our discussions for today. Any last comments?
3 main takeaways or thoughts I would want to leave you guys with. How to deal with this situation and how to make it a learning for any future difficult situation we come through. The first is communication. Communication is key. Communication is always key. It's just become even more challenging in a virtual world situation right now. So be proactive, stay connected to your stakeholders, reach out to people, talk to them, ask for help in any way or shape possible. Is important to keep the communication levels going up. Second is upskilling yourself. This is a nice time, however difficult it is to take a step back, reflect on your life, your career so far, and see what you need to upskill yourself. Education, formal degrees help you to an extent, but skills is the key. Skills is the need of the hour. So anything that makes you feel uncomfortable, you feel like you're not confident, this is a good time to step back, look at it, and try to overcome and learn new skills in areas of of your interest. 3 is it's easier said than done. It's just to stay positive. We all have just one option, just stay positive. Feeling the negative emotions is natural, but the negative emotions is a virtuous cycle. It's a vicious cycle in many ways. Feeling negative evokes more negative reactions, more negative behavior, more negative communication, and it just goes on a endless loop. The only way, and that starts with you, is just be positive. Somebody has advised me in the past, how do you be positive? It's easier said than done. Being positive is harder when you're in a difficult phase of your life, but acting positive is easier. It's acting. You try to be positive. More you start with acting positive and trying to show that you're positive, the energy from others, oh wow, this person is trying to be positive in a difficult time. So the energy, the support, the motivation, the encouragement that you get from others will make the same vicious endless loop go in the positive direction. So stay positive, stay safe.
I'm happy to be here, and I want to applaud the GSACovid team on their effort to help students during these difficult times.
Thank you very much for the GSACovid team for giving me an opportunity to share my perspectives on the current COVID situation. I'm happy to be engaged with this group, and I appreciate your efforts, and I sincerely wish you all the very best. Thank you.
Thank you. And now let's hear from our community leaders on what they think about this initiative.
Hi, my name is Armando Guerra, past district governor for New Jersey, District 16J. I'm very proud of the Renaissance Leos and their leaders for putting together this initiative, the global stand against COVID, the mental health awareness and the challenges that it brings. I'm excited that the Renaissance Leos brought prominent speakers that will answer those questions. I am proud about the Leos in taking this initiative to the next level. As a result, they will become our future line leaders. At the present moment, the Renaissance Leos are raising $20,000 to donate to LCIF. So far, they have raised $5,500. So congratulations. Let's continue to roar to new horizons. We serve.
Hello Leos, I'm Leo Lion Ayush Bagla, your board liaison for the year 2020-21. We are living in unprecedented times, and it is times like these that we need to take care of each other. When the pandemic has moved the world apart and shaken the very foundation of how our society works, it has become more important now that you and me, the young people of the world, take things in our hand. So, let's all together support our Lions Club's International Foundation, which till date has disbursed grants worth more than $5 million throughout the world in their COVID response. Please remember, no support is ever so insignificant. Your one act of kindness can change someone's life forever. So let's all get together, Leos from all diverse backgrounds, and show the world that even in these times, we are united in kindness and diversity. Thank you.
Such deep insights and personal experiences shared by our professionals here today have helped the GSACovid team tremendously in crafting an action plan and keeping strong mental health. My leadership team and I hope that it helped the students and their families watching too. Please keep following us on all of our social media platforms, Twitter, Instagram, Facebook, YouTube, all at GSACovid, as well as our website, www.gsacovid.org, in order to get more information on our panelists, as well as ways you can help and seek help. Remember, no help is too small, and there is always something you can help with. You'll never know unless you reach out. Also, please let us know your personal experiences around applying some of these insights into your own daily lives during this pandemic by commenting on our posts, through videos, or even emailing us at info@gsacovid.org. Make sure to be as creative as possible, and some of the most creative and positive responses will be featured on our next show, which is going to be aired next Sunday, and will be focusing on stress and exhaustion related concerns. Additionally, our team here at GSACovid has organized a virtual fundraising campaign to raise funds and donate to the LCIF, the Lions Club International Foundation, to disperse across the globe for COVID relief. We have raised around $5,000 in our first days of this campaign, and our ultimate goal is $20,000. Please click the donate button on our website to donate today towards communities across the globe and help them face and fight COVID-19.
All volunteers that help us raise funds for this cause are eligible for the Melvin Jones Fellowship Award when they raise funds over $1,000. There are currently only 440,000 recipients of this fellowship award worldwide. I am so proud to announce that 2 GSACovid leaders have qualified for this award. My fellow leader, Rudrani Ghosh, and myself, Anjana Ashokchari. There is always an opportunity for you to be an MJF qualifier too. Just reach out through our website.
Together, let's take a global stand against COVID. Are you a student going through a lot of anxiety?
Maybe stress or uncertainty due to COVID? Well, just know you're not alone.
We know what it's like to be going through all of these things, and we are here to help.
So come join us on all August Sundays, starting August 16th, where professional panelists will be sharing
Their personal insights and their own stories of COVID-19
to help create more awareness around mental health challenges during this pandemic.
Let's take a global stand against COVID.
Teen Talks every Sunday, 7 p.m. Eastern, 6 p.m. Central, 4 p.m. Pacific times, only on TV Asia Telugu.